My name is Gerald Tobias. This video concerns cancers due to radiation from all types of medical tests. The use of medical radiation testing is soaring, and an increase in cancer rates is a certainty. In the US, 70 million, 1 in 5, had a CT scan, and 1 in 17 had a cardiac nuclear scan, and there are many billions of other tests that are being done yearly. Most important, children are 3 to 5 times more susceptible to radiation-induced cancers than adults. The younger the child, the higher the risk. If an adult man has a CT scan and the radiation exposure is equal to 500 chest x-rays, then in a child, the exposure is 4 times higher, or 2,000 chest x-rays. In girls and women up into their 40s, if the radiation test involves the chest or abdomen, their exposure is also 4 times the man's dose. Young men in their 20s or 30s can have double the risk than of men in their 60s. And women over 40 years are 30% more susceptible to radiation-induced cancers than men of a similar age. The dose of 2,000 chest x-rays is acknowledged to cause a small increase in cancer. Increase that 2,000 to 5,000 or more, and the cancer risk goes up. There are people whose exposure due to excess testing exceeds 25,000 chest x-rays, and they are unaware of it. The question, do hospitals, cardiologists, physicians clearly explain to their patients about the danger of radiation tests that they recommend? With few exceptions, they don't. Just the opposite. They hide the dangers. They say the exposure from cardiac nuclear scans is equal to 1 chest x-ray when it is 1,000 or more. They say it is safe, and it isn't. They say it is a small dose or a small amount to mislead, when it is not the volume size, which may be very small, but the potency that counts. They say it is nothing more than a multiple of natural radiation. This is misleading. Life on Earth over millions of years has evolved so it can repair itself from yearly natural radiation, since it is spread out over every minute in a 365-day year, a microscopic dose of 3,000ths of a chest x-ray per minute. But a CT scan would cause 100,000 times that exposure in a minute, and that dose can be too much for the body to repair. It would be unquestionably more informative if all doses were described in chest x-ray equivalents. Chest x-ray equivalent descriptions to patients are never used by physicians, to my knowledge. A year ago, I sent letters to 36 cardiologists in 3 offices whose patient brochures spread this misinformation, that 1 cardiac nuclear scan is equal to 1 chest x-ray, when it is really equal to 1,000 or more. As of today, 28 cardiologists have responded and changed their patient information. One group changed the 1 chest x-ray description to quite safe. The second group eliminated the 1 chest x-ray description and left out all mention of the radiation of the drug. The third group has never responded nor changed their 1 chest x-ray dose description. The exposure from injected radioactive drugs is much, much more dangerous. At first, the drug is spread uniformly throughout the body, and that average organ dose is what is mentioned in most of the medical literature that physicians read. But organs that excrete the radioactive drug from the body, such as the large intestines or the kidneys, can get 3 to 8 times the average exposure, and therefore those organs are at a much higher risk of future cancer, and the increased cancer rate in these organs bears this out. Important basics. The occurrence of fatal cancer in anyone's lifetime, even with no medical radiation at all, is 1 in 5, 20%. Medical radiation adds only a small fraction to this large number, unless you are very young or have had repeat exposures. These radiation tests have risks, but admittedly, so does everything else in life. Many tests involving radiation are important, but not all. Medical literature states that up to 30% of radiation tests are not needed. Be sure to question the need of all tests. There is no exactness in the doses of most medical radiation tests, and some can be off by more than 300%. Holding doctors responsible for not warning patients about radiation-induced cancers is almost impossible, since the exposure would have happened many years earlier, and the cancer that results can be of any type. After a cardiac nuclear scan, there are usually no side effects that one can sense. But a Geiger counter would signal to you that you are giving off radiation. This is why you are told to keep your distance from infants, children, and pregnant women after the test. Let's remember, radiation tests can sometimes be substituted by MRIs or ultrasound, which give no radiation exposure. These alternate testing methods will only happen if you ask about it. Radiation exposure chart below. The radiation tests in the table below are listed in order from low to high doses. You're familiar with some of them, but be sure you know the risks associated with them. Note mammography in row D and how each 10 years of testing increases the risk by a factor of 10. Make sure to keep a lifetime record of your family's radiation tests. Remember that X-rays of your arms or legs are of much less concern when they are of your body. I hope you found this information helpful. This is Gerald Tobias. Thank you very much for your time.